Hello, everybody. My name is Cihan Çobanoğlu. We are live on YouTube. Welcome to the panel by the M3 Center for Hospital Technology Innovation at the University of South Florida. I would like to introduce our moderators, Dr. Joe Askren and Mr. Gary Colpitts from University of South Florida. Joe and Gary, the floor is yours.
Thank you, Cihan. Appreciate it. So welcome, everyone. I'd like to give a hello to everybody who's joining us on this webinar. I'm Dr. Joe Askren, and I work at USF in the College of Hospitality. I'll be one of the moderators today, along with Chef Gary Colpitts from our college. So our focus today is on the current food safety landscape in restaurants, changes in food production protocol, and new trends that may become opportunities in the future. And I know there's a lot going on today with this pandemic. I'd be remiss if I didn't say COVID-19 has certainly rocked communities and families around the world. So our hearts and prayers go out to all who are struggling and dealing with issues beyond business and economics. So this webinar is about planning for the future. We hope to touch on some key areas relevant to restaurants. And our panel today is a great one. We're so lucky to have them. Wow, you guys are in for a great treat. Can't thank them enough for taking time out of their busy day to join us in discussing the restaurant industry. We have Carol Dover, president of Florida Restaurant Lodging Association. We have Chris Tomaso, CEO of First Watch Restaurants. Jenny Kruger, restaurant operation consultant for US Foods, and John Horn, owner of Anna Marie Oyster Bar. So let's get into it. If you're not on the panel and you're joining us on the Zoom link, just mute your mic, that'd be fantastic. And we're gonna, the format's gonna be like this. We're gonna ask them a question and then give each panel member a couple minutes to answer and comment. After everyone's finished, we'll ask any further comments. We will also be maybe getting some questions from the live YouTube feed. But after we get through with the question, everybody's good with it, we'll just move on from question to question, okay? So, as you know, the presidential guidelines, that three-phase guideline came out at the end of last week. And we're not in phase one yet. It might be a little while before we're in phase one in the state of Florida here, but it states that sit-down dining will be able to operate, quote, under strict physical distancing protocols. So I want to think about some specific areas. I want to just kind of think about this with our panel. Specific areas relative to the operations when we reach phase one. So we have host stands, hostess stands. We have front of the house, back of the house communication going on in restaurants. We'll have, of course, prep areas, food storage areas, food presentation, whether it's going to hit a plate or go into a to-go box or something like that. So, Chris, I'm gonna start with you, Chris. I'm gonna ask you what specific food handling protocols have you considered changing, maybe modifying or adding to combat COVID-19 in the restaurant food production or delivery?
Yeah, thanks, Joe. I think it's important to know that you said, quote, under strict physical distancing protocols, those have yet to be shared or maybe even developed at this point, which is making it, quite challenging for us restaurant operators to plan for a reopening, not just here in Florida for us, but we're in 31 states. So trying to understand, if each state is going to do something differently. And actually, since the time we all agreed to be on this panel, as late as last night, 2 or 3 states said they're going to open as soon as Monday, and not in compliance with phase one protocols, which would give us a couple of weeks notice with declining COVID-19 case, diagnoses. So even just from last night till tonight, it's been a whirlwind of trying to understand what to do in those states. But there are some key fundamental tenets that we've already decided that we would adopt. One is we're doing symptom checks for our employees when we come back. I think it's important to mention that we closed all of our restaurants, almost 400 restaurants on Easter Sunday, just because we were doing to-go and third-party and off-premise, but at that time they were saying that the worst part of COVID-19 was yet to come, and we just felt like for the safety of our employees that it was best to close down for a period of time. We didn't know how long it would be. It appears that it's will open sooner around the country here, but so when we come back, what we've been working on while we're closed is these commitments, for example. So one of them is a symptom check, where we've sent thermometers to all of our restaurants. We've actually put in some questions in the POS when the employees go to clock in. they're forced to answer 3 questions about their health and safety that relates to their temperature, have they had any symptoms, and those type of things. So those were 2 kind of pre-screening ways to make sure that our employees are healthy when they're in the restaurant. We've also decided to permit masks for our employees and customers, and that's very different from requiring, because again, we're not sure what the local jurisdictions are going to do. But if one of our employees wants to wear a mask because that makes them feel safer and more comfortable, we're okay with that. Yesterday, as a matter of fact, we went to one of our restaurants here in Sarasota and rearranged the dining room to see what it would look like with 6 feet between each table and chair, so that no 2 customers were ever closer than 6 feet outside of their own dining party. We know that there's going to be things like, I'll just focus on front of house for right now, no gathering up front. And for a restaurant like us that could typically be on an hour wait on a Saturday and Sunday, that's a big challenge for us to figure out how to manage that. But we're putting things in place along those lines, and I'm sure the other panelists have some other examples. But one back of house thing that is a little unnerving right now is I am hearing that there might be a 6-foot distancing requirement for back of house, and there's so many restaurants that aren't even able to accommodate that. The stations are set up where they're set up, and I'm not sure how that would ever be applied. So, really, I've been, as recently as yesterday, had a conversation with Carol about getting some of these points that are important to restaurant operators out there, and make sure that it's people who understand the restaurant business who are making these strict physical distancing protocols, if you will. So I could go on for a long time, but I'm going to give the others a chance to say some things there.
Well, that's some great stuff, Chris. A lot of work on your part just thinking about this. Jenny, you want to add to any of this conversation? Question?
Sure, absolutely. Thank you, and thanks for having me. Chris, awesome ideas. I echo all of those. In talking to a lot of our restaurants with US Foods and just gaining ideas all over the country, really. Some things that we've thought about was potentially digital or disposable menus only. So you limit the amount of hands touching or coming into contact with anybody else. Sanitation stations all over the restaurant for customers and employees, making it very visible to people. So enhancing that comfort level of our customers that right now is trending, right around 15%, that the customers actually have no concerns at all and are ready to go out. And you mentioned, we've talked about the gatherings that, if you're on a waits are awesome. We love that. But how to handle that. And some restaurants, have adopted already thinking about paring down their menu to make sure that the tables are turned a little quicker. So we kind of eliminate a little bit of that, and maybe even going to patio seating only, especially here in our beautiful state. We have that option right now. So that might make people feel a little bit better too. But definitely that seating chart needs to be adjusted to help our customers feel better about coming in. So thanks for the input. You gave me a couple ideas too, but I'll pass it off to the next one here.
Yeah, this is great stuff. Carol, you want to add to it?
Sure, I'll be very quick. Again, thank you for including FRLA. Many of you probably know that the governor has appointed the task force now that will be just looking into how to reopen Florida. And it's so wonderful to see all of the restaurant members and hotel members of ours that are on the task force, because I think it's critical. I sit on both the National Restaurant Association and the American Hotel and Lodging. And what we're so concerned about is what you mentioned earlier, is that we don't need 50 states with 50 different ways to reopen and 50 different social distancing regulations. So one of the things that I've been working with this administration on is that it's really easy to say, we're thinking about 25% or the 50%. We would prefer that they go with 6-foot distances, because it changes the dynamics. You can say 50% seating or 25% seating and have a lot of floor space still available. So we're thinking right now that it might be better for the industry if you just give us social distancing footage. I heard this morning that the rumor is out there that it might be as much as 10 feet. We have not heard that. I have not heard that at all in the state of Florida. So that might be coming from another state. One of the things I want to say about FRLA is that we are the premier association for education and training, and have been. We were the first state in the country, most people don't know this, that passed the food handler mandatory training program. So we get this part of it. I mean, this is something we do well. We do, we train thousands and thousands of people a year. So we are in the process of updating our training program to include a lot of the new ways of having to do business. Certainly, we're going to be watching the governor's task force to make sure that we implement in what the governor's administration would like. We're going to make sure that we build the consumer confidence. I mean, that I think we all know is going to be our biggest challenge, is making the consumer feel that it's safe to go back inside, if you will. And so I like, this is super helpful for me because, like Jenny, outdoor seating has been discussed a lot with this governor. He's very, very comfortable with that, but not everybody has that opportunity, right? So that's something we have to work through. Chris, the back of the house having social distancing would be a nightmare. We have to come up with a way, because none of you want to go back and completely redesign your kitchens. So we do have to think about how we're going to handle the back of the house versus the front of the house. But anyhow, I'm going to turn this over. I know John has got a lot of great ideas, but I do want everybody to know that the Florida Restaurant and Lodging Association will be here and ready to be on the front line to help with our training and trying to build consumer confidence.
Yeah, we're lucky to have you, Carol. Thank you so much. And I just to reiterate what you brought up and Chris brought up too, is it's so important. I agree to have people who know the restaurant industry, the interworkings of the kitchen and front of the house and back of the house communication. Those are the kind of experts we need in there creating legislation on all these protocols and guidelines. It's critical. And I couldn't agree with you more. Giving restaurants that distance choice versus just a pure number like 25%. I mean, it gives restaurants the ability to be creative in these guidelines. John, you want to take some of this and give your input?
Yeah, just a couple of things to add, because I mean, I think we all work off of each other very well. The association has been feeding information to its members. We can't, within our group of 4 restaurants, come up with as many ideas as Chris can in his 130, which, the Burger King guy that was on the meeting this morning with his 700. So we're all getting information from everyone else. And one of the ideas I heard this morning was that McDonald's is using a QR code for the menu. You walk into one of their restaurants, Disney, you walk into one of their restaurants, you hit the QR code, and the recipe for that, the menu for that restaurant comes up on your phone. So we're going to go with single use, copied menus for a while. We're paring our menu way down for our initial opening so that, we can handle what's coming in. We don't have any waste in the kitchen. And, we're going to have something that travels well, because if we're even at 50%, we've got to offset that with probably 50% carry out. So we've got to have a menu that we can really crank out of the kitchen and get it out there. We've already talked about bringing our prep crew in the middle of the night. So normally the kitchen closed, we'll open our kitchen to have the prep crew in there so they can not even be in the kitchen when the cooks come in. All the prep will be done. Everything will be, the box will be stocked. So I don't have double people in the kitchen. There's no way in the world any kitchen can have 6 feet, 10 feet. You're bumping into people in the kitchen. But if I can have my prep crew out of there before the cooks come in, that's a lot better for us. We've got digital boards that we're installing in all our restaurants right now. We're doing 6 to 8 digital boards in each one to put menus on. So people from everywhere in the dining room can see a menu. So we can put a menu up there. You don't have to have one in your hand. There's a lot of things. The no wait, we use no wait. People can sign in on the wait on their phone. They don't have to get a beeper, a pager. We'll text them when their table's ready. We're working on the algorithm so that it's not the same wait that it was before. It's not calculating. It'll be a 10-minute wait. It's almost double now if you're at 50% capacity. So, you have what normally would be an hour wait. It's going to be tremendous now. So we're working on all of those factors. So we're trying to cut out the contact between the guests as well. So, and a lot of that'll be covered later, but we're doing those things because it's going to be imperative to do everything we can. But you got to get ideas from everybody. You've got to get your coworkers and your co-restaurateurs to give you ideas, and that's been helpful with the association.
Fantastic. Yeah. Just talking about this, checking in and putting in a reservation or congregating at a host stand, I think the parking lots are going to look a heck of a lot different now. People will just be waiting in their cars and waiting to actually come in the restaurant. It's interesting. Fantastic. So, and what Chris was talking about with the system or the symptom check and the questions for their employees when they check in, maybe that might be a way to lessen or mitigate some of the 6-foot distance recommended in the back of the house. All right, let's move on. This is great stuff. We're off and running here. Thank you so much. So, Jenny, I'm gonna start off with this next question with you. And so, what are the changes you foresee, if any, in the basic food purchasing cycle to ensure a secure supply chain in the restaurant industry?
All right, so I'm going to take this from the distributor side because naturally that's what I've seen the last few weeks. And it's a little bit of a crystal ball kind of a question, but that's what we have to go on right now, right? We have to kind of imagine, how our population is going to react to all of the things that we have. But, as far as the distribution side, we realized really, really fast, as did the majority of our customers, that this is all so fluid with, just what's going on, the numbers, the curve, and all of that, that it's so fluid that we have to react and we have to be able to pivot. And I'm really proud of our organization that we realized that super fast. And then we helped our customers be able to react and pivot. So, things like Chris said, and John said, paring down your menu, things like that, immediately you have to do it. Don't be afraid to reinvent yourself. And that's what we did, with a decrease in independent restaurant business and supply and demand by almost 75% within like just a few days. That forecasting is pretty much non-existent. So what we had left in our warehouse, as any distributor of anything had, we had to react and try to get that out to our customers and help them pivot too. So what I personally see is, based on that supply and demand till we get back on a regular track on the other side of this, I think that very fluid menus, using your creativity, is going to be paramount and necessary, especially for the independent restaurant out there. And emphasize the experience that your customer is going to get. And you can do that through social media. Social media, the bandwidth is enormous right now. It's everyone is surfing everything and they're craving things to purchase. So to get yourself out there and do that, we've been helping our customers do that a lot. So you have the ability when you do that to shift your menu then. Have ideas like Mother's Day specials, brunch specials that might not have been on your menu before, just like we have where we might not have the stock of product that we did before because we've had to find different avenues for it. And then I think in the future, as far as this, the distributor side, personally, speaking just for me, what I thought of was I see a little bit more stringent, having that dependable, more traceable track that you're receiving your product from. So I can see, we've had in the past a little bit of issue with food being delivered in cars or off will calls, things like that. I really see that becoming a much bigger issue in the future. But again, that's me. And, just really what I'd say on the distributor side is just pivoting, not being afraid to reinvent. Then that likewise with the restaurant. So if you're able to do that, there's certainly a way to survive and certainly thrive. So,
yeah.
Great, Jenny. John, any thoughts on purchasing cycle?
Yeah, absolutely. Because I think, and I've had several conversations with my friends at US Foods because I think the demand for domestic product is going to go through the roof. People want to buy domestic product right now. And when we get back, that's, I think it's going to be so focal to eat local and
Yep.
almost entirely domestic. So we're working on that. I think one of the good things of the way I'm seeing, obviously nobody has a crystal ball when we'll open up, but with the 14 days after the cases, start going down, I think we're going to have a 14-day window. We know we'll be open within a window. So because as Jenny was saying, they don't have product in their warehouse. I don't have product in my restaurants. So it's not like when we close, you can just shut down and stop. It's going to take a ramp up time. So fortunately, we're going to have a way to ramp up, but that's going to be crucial because everything there's nothing in the restaurants right now. So to get everything, it's like opening a brand new restaurant. You've got to start over. So they've got to have the product that I can get from them, and I've got to get it in, and I've got to get it prepped and ready. So at least we'll have, a semblance of a 10 to 14 day window. We know that we'll be open in that. So it's going to take a lot, and it's going to take a lot of planning, but they're all with it.
That's a great perspective, John. Yeah, it is like everybody's opening up all over again on whenever that day comes in the state of Florida. Carol, anything you want to add regarding purchasing cycle?
Well, I'll tell you a little bit about the opening part of it that I've been hearing from the governor's office and the administration is, I think, that 14 days that John referred to, I mean, there's no accident that 14th day lands on the 1st of May. So if you really start to think about May 1st being hopefully, and remember that we have to go 14 days without an uptick. So, unlike China, who went for a while without, and then all of a sudden it went back up, we need to hope that it doesn't. But let's just say that it doesn't. I do think that there's a good chance we're going to see us need the supplies by the 1st of May, but in a much less capacity than we were. I do think the soft openings are going to happen versus just opening the doors, But to the point of the supply, I've also been working with the Department of Agriculture quite a bit, and farm to table was big before, but it's going to be huge now. I think we're really going to see, to John's point, buy local, grow low, try to not have as much shipped in. I'm not sure what that's going to do to our suppliers, but I can tell you that grocerants have become a very big trend in this, and it's been helpful to the Department of Agriculture. It's been helpful to the consumer to be able to get your restaurant, your dinner, and pick up a head of lettuce and some tomatoes and maybe some fruits and vegetables that were grown locally. So I think we're going to see that trend too. I mean, let's think about it. It's sad to say this, but we have to find that there have been a few silver linings that may come out of this very tragic situation. And I think one of the many silver linings is exactly that I think our farmers are going to take on a whole new meaning in our supply chain, which is, I think, a positive for the state of Florida.
Yeah, we have a lot of people commenting on the YouTube stream exactly that, just making comments about eating domestic, local. I couldn't agree more. Good
Support
comments.
your farmer.
Good comments. Chris, I want to bring you in on this question too, but I had somebody make a question about an earlier thing we were talking about connected to your comment on the last question. I think you said you were doing symptom checks, and did you mention about taking temperatures? I think, did you mean guests and employees, or just employees?
It's certainly a consideration. Our focus initially is on the employees to make sure that nobody's coming into work sick. And if they have a temperature of above 99, then we send them home. Is what we're doing. But there's a lot of talk about testing customers as they walk in. It's very common, in the Far East, as when you get off an airplane, you have your temperature checked and those type of things. But it could be part of our SOP, not just for restaurants, but just for businesses in general going forward. So yeah, that's certainly a possibility. And then on the supply chain point, some of the things we've been looking at is moving to night drops so that the folks that are delivering the food have less interaction with people. They've had concerns about going in and out of restaurants. So setting up night drops, for example, and then also reducing the number of deliveries for now. Our business is going to be, diminished by whatever percentage the dining rooms are set up by. So if it's 50%, we have produce deliveries because fresh produce is such a big part of what we do 4 times a week. That might go down to 2, for the business, but also to limit the amount of, people coming in and out of the restaurant. So same thing with our mainline distributor. We might either move to the night drops or reduce the number of deliveries, and that helps them too for right now because they don't have the drivers that they had before. You know, there's some challenges on the supply chain side too. So just those type of things that are more kind of blocking and tackling, trying to figure out how best to do that.
Wonderful. Sounds great. I want to bring in Chef Gary Colpitz. He's in our College of Hospitality. Gary, you wanted to ask him a question.
Yes, thank you, Joe. This question, I'll start with John. I just want to say hi to the panel. You guys are great, and I'm just honored to be here. First question is, we know both Anna Marie Oyster Bar and First Watch pivoted service and offered to-go dining during the early stages of COVID-19. I'm sure there was a learning curve on this, those services offered for both restaurants, and many are in the state of Florida and all over the country. Can you share any additional opportunities that were discovered at your restaurant because of the changes you were forced to make?
Gary, I'll be happy to start with that one because we used to think we did to-go pretty well.
Right.
We were horrible, and that's giving us a lot saying we were horrible. When we were open regularly, we were doing about 3% to-go business. I mean, we're just not set up to do a lot of to-go. It's an experience to come in and sit down. So we never concentrated on to-go. And so then when the dining rooms were closed, we went to go business. We couldn't handle it. We were just like, you got to be kidding me. It's a whole different setup. You've got to have everything ready to set up for it. So we've been redesigning our kitchens to be ready for to go. We have set up 3 separate areas in 3 of our restaurants to handle to go when we open back up. We're rerouting printers so that they'll go into a separate area that we can deliver the food and then package it, stamp it. We've set up, so we've almost got drive-up windows at 3 of our restaurants for to-go business. Again, if we're cut down to 50% in the dining room, we've got to make up those sales somewhere because it takes the same number of kitchen staff. Your payroll in the kitchen is exactly the same whether you're doing 50% or 100% of sales. So it's not economical to do 50% of sales with that number of people in the kitchen. So we are setting up to do hopefully 25, 50% of sales in carry out and to go. So we have completely reestablished it so that we're set up for it because we've got to be better at it. We've got to have better packaging. You've got to have the procedures that you can accurately do carry out business because there's nothing worse than getting home and missing something, not having what you ordered. There's nothing worse. It's not like the server can, fix your meal that we messed up that wasn't ordered properly, whatever the case may be. When you're at home, Joe Pesci just comes to mind every time I think of to go. So you don't want that to happen from our restaurant.
Right.
That's wonderful. No, John, thank you so much for sharing that. Chris, would you like to add to that?
Yeah, I would say we were probably just as bad as John. We did to go and breakfast just isn't a big thing, and we were about 3-4%, and most of that was at lunch. And we did an okay job with it. Thankfully, we had already started an initiative. We completely redid all of our to-go packaging, and we were working on standing up a structure that would allow for online ordering and working with the third-party purveyors all over the country. So we were pretty far along, but we certainly had to accelerate that, and it was a little bit of trial by fire. And one of the key learnings, I'll just share one, was we know that all of our restaurants have community tables, and we know that community tables are not going to be a thing going forward. So we're repurposing those community tables in the front area of the restaurant to be the third-party delivery pickup areas. So we'll bring the food up there, we'll set them up. DoorDash will have their own lane. Bite Squad, whoever it is, they'll each have their own lane.
Right.
And we've created stickers that not only seal the bags, but also put the logo of the company that's picking it up and the name of the consumer that placed the order, so that when the driver walks in, we want those drivers in and out as fast as possible. We don't really want them in our restaurants. So if they can go to their lane, look for the name of the consumer that they're picking up for, their logo, and get out. So that's the key learning for us that we'll be implementing as we go forward here.
Wow.
Chris,
Right.
are y'all doing as much contactless payment? I mean, we're working on that as well, so that there's no transaction, there's no exchange of, well, obviously credit. We're trying to do as many on credit cards as possible.
Yeah, we during this downtime, like I said, we thought we would be down 45 to 60 days. It's going to be less than that. So now we're really running on the treadmill. But we are implementing EMV in all of our restaurants, and we'll be set up to take Apple Pay, Google Pay, and ultimately gift cards and other things to hopefully reduce our cash transactions even more. One of the other things we're doing is, like you, we're a tip restaurant. So even if you use the chip and pin or the Wi-Fi enabled one, you still have to put in the tip. So we're putting in styluses at the host stand right by the POS, so that and there'll be clean ones and dirty ones, or sanitized and unsanitized. So you'll take a stylus, do the tip, and then put it in the unsanitized one. We'll take those, sanitize them, and move them back out front, because we can't get away from people having to put a tip on there. So, but yeah, we're moving as much as possible to contactless payment.
See, I told you we could learn from others.
Yeah, great.
Collaborative learning,
Great.
absolutely. We're small.
Yeah.
Thank you, Chris, for that. Jenny, do you see a question for you? Do you see any opportunities there?
You know, once again, I'll kind of relate it to just the hundreds, literally, conversations I've had with customers all over the state, and in a few states actually in the last few weeks, that, you know, different ideas, like Carol mentioned, the grocerants are huge. Just that community cohesiveness and having that restaurant reach, you know, that community outreach, that helps. A lot of meal kits. And I heard a clever one today. Teacher Appreciation Day can actually be coupled with Mother's Day. I thought that was clever. So, you know, getting those clever, creative things going, right? You can steal it. It's all yours. But not only that, but, you know, brunch, a free bottle of champagne along with a gallon of orange juice, and different clever, charming ideas like that people are literally just craving normalcy, right? I mean, the post that you see on social media right now, I saw one the other day that's a lady going to put a cocktail in each room of her house, so it feels like she's bar hopping. You know, it doesn't get much more normal than that, right? And so they're craving that, though, and those are the things that get shared. So I'm going to take it a little bit back to social media. These ideas are fantastic. Thank you. I'm super stealing from you guys too. But if you don't socialize that online in a way that taps into those feelings that people have, you might as well not even do it, right? You got to let people know. So creating that that peace of mind too, that compassion and empathy for how our customers feel. I've seen splash pages that come up when I get into a restaurant's website that literally give me goosebumps and bring a tear to my eye right now, because they're touting how much they care and how much they care not only for their customers but for their employees too. That's a really big deal. So I guess just to add, I would say socialize everything you possibly can, so that customer feels comfort when coming to pick up from you.
Thank you, Jenny. Carol, would you like to add to that?
Yeah, you know, I'll share with you what, from an association perspective, was probably our most, I don't want to say controversial, but I guess our most talked about, trying to figure out how to handle alcohol. You know, alcohol delivery, the alcohol statutes have been very, very stringent and pretty solid for, you know, since Prohibition. And so to allow restaurants to start to lift the ban on takeout was a very big deal. And I want to give a huge shout out to our governor, because I can tell you of restaurants that have told us that but for that change, they would never have kept their doors open for takeout. It just would have never been worth it. And then of course, you know, we've got it now where they're making drinks and putting them in sealed containers. So these are things that, you know, who knows? They're parts of maybe a very antiquated statute that needs to be looked at anyhow. You know, a lot of people were concerned about, you know, them opening the bottle or the beer. I mean, let's face it, if you buy it from your grocery store, you can open it just as fast driving home as you can walking out of the restaurant. And so I think that is a part of the distribution system that we're going to be taking a look at legislatively and politically.
Great stuff.
That is great. And just one other thing I'd like to add. now with the increase of curbside and takeout and how that's going to change your business model a little or a lot, how about with alcohol? How about with food allergies? How do you control that maybe? Are you more vulnerable because of the takeout or curbside? Maybe if with individuals with food allergies, how do you monitor that, control that, or no?
It'll probably just be in the ingredient label of any of your menu item.
Yeah.
I mean, someone will be asking a little bit more specific. But
Okay.
if I can just add to Jenny's, we posted something yesterday, a video on our Facebook page, and it was us training our servers how to do social distancing. And it was obviously a farce. We had 2 tables out near the lake outside, and they were basically throwing food at the 2 tables. They said, you ordered a burger, and they threw it. And it's had almost 25,000 views since.
Oh my gosh.
Yeah, it's been shared 231 times. I mean, it's just.
That's fantastic.
Excuse me, can I get some salt? And she throws a shaker of salt at it. I mean, it's great fun. And that's what you should do. You gotta show that we are training people. It's gonna be different. Obviously, we're not gonna throw food at people from 6 feet, but we're gonna try.
Learning curve indeed, yes.
Yeah.
Last question. What changes, if any, should be made to the current Serve Safe or Safe Soft training?
Right.
And I'll start with Carol.
Well, thank you for that question. I can tell you that we stay on the front line of the training regardless of COVID-19, right? I mean, we have a seat on the Conference on Food Protection. I sit on the national boards. Like I've said, we've got some of the best food safety experts truly in the country that help us before this. But now since this, there's no question it's caused all of us to revamp and look at things. Now, we have to remember that COVID-19 is not a foodborne disease. So that I think is critical, that people don't begin to panic and think of it like E. coli or some of the others. So there's no question that ServSafe is going to have some new additions to it. We're working on those now. Every day, every single day, we have a National Restaurant Association call, and this is one of the main topics. With that said, I can tell you that as I started this panel, talking about our food handler training, because remember that Florida, if you don't know this, Florida is one of the states in the country that has mandatory food handler training. We've had it for over a decade or more. And not every state has that. So every single person in our food service industry, restaurant industry, has to be trained. That training is getting ready to take on a new meaning. And we are going to add a lot of things, like I said, that and I'm sure ServSafe will too, but things like social distancing. I'm not even sure a lot of us even understood what social distancing was 2 months ago, right? It's kind of a new term in our world. But I want to share something with you that's been a vision that I'll close on, because I think it is super important, and I'm kind of excited about getting this off the ground. Many decades ago, we had, some of you might remember, a huge E. coli outbreak, and a lot of people unfortunately passed away, and it became a very big media deal. And we had like a seal of commitment that we talked about back then, and we kind of shelved it for a little while, and we're dusting it off the shelf. And this basically would work as that consumer confidence. So under Florida, you have to take your training. So when the training is done and complete, then, and we at FRLA keep all the data, we would know that you have gone through not just your basic food handler training, but your pandemic training or your additional food safety training that we will be adding in as a result of this. And then the establishments, some of you might be old enough to remember the good old housekeeping seal of approval. Then we would be giving the establishment some kind of a recognition, whether it's a gold seal of commitment. It's stating to the public that this establishment, 1, has done its training, and 2, holds itself up to the absolute highest of standards. Because as you know, ServSafe is by far the highest of standards. And then you can use that in your social media, in your marketing, put it on the door, make sure that the consumer knows this is a safe, it's kind of like that AAA rating or the ratings that hotels. We want to make sure we start to build this marketing in for our restaurants so our consumer will know when they've properly done their training. And with that, I will check out and turn it over. I know we're coming to an end. I want to thank you for having me, but I'd love to hear from the others what they think about the ServSafe training.
Carol, thank you so very much. John, would you like to add anything to that?
Sure. And again, I tend to brag about the FRLA, but that's the source of things that we need is our association for the hospitality industry. You have to look to them. And I reached out to Carol after being on a call, and they're like, the industry needs to say, these are the parameters that we want to open up with. I reached out to Carol. I said, I'll be happy to help, get on a committee. And she's like, John, I've been talking to NRA. And so, I mean, we have so many sources and experts to help us with this, because it needs to be all the way across our industry, because it's all about consumer confidence when we open back up. So if Chris's restaurants, everybody has masks on and my restaurant doesn't, then somebody's going to say, well, I was at First Watch and they're a lot more cautious about their guests than you are. So we've got to come up with a standardized so that everybody's on the same. If masks are what everybody needs to be in, then masks are what our staff should be in. So we've got to come up with where it's going to be so that we're all the same. And there is a standard that we all uphold, that we're taking temperatures of our staff. We're asking them 3 questions when they walk in the door. And if they're at 99.0, we ask them to go home and come back 14 days. So all of this has to be standardized because we want the consumer confidence for all of our restaurants. I want them eating breakfast with you, Chris, lunch or dinner with me. I want them eating out again. That's our whole role, is to get people comfortable, confident, and back in our restaurants and our hotels and traveling and the beaches and everything. But it's got to be a safe environment, and we've got to ensure that we're making it safe for our customers.
Gary, can I jump in?
Please do, yes.
Yeah, John, that's great. Actually, that was one of the comment questions that just came in as you were saying that. Somebody commented and asked if FRLA would be working on some kind of best practices list for both front of the house and back of the house.
We are.
Fantastic.
Yes, we are. And if I can, I'm going to really quick hit on something that is super controversial, and I think that we also need to address it. And that is the gloves issue. The Florida Restaurant and Lodging Association for years have defeated legislation that mandated gloves. And many people would say, why? Well, I was sitting at a restaurant the other day getting my takeout, watching the gloves get the money, go to the cash register, run inside. I have one that was wiping his face. And if we're going to use gloves, there has to be training. The glove is only as good as the clean hand that put the glove on. It's why you see doctors not touch anything when they put those gloves on. So I think that is a false sense of security that concerns me, that everybody's going to run to gloves. And I'm not saying they're bad. I'm just saying if we're going to put them in as part of our protocol, we need to put additional safety measures in with how to properly use the gloves.
Great point, Carol. And you're right. We become, we're invincible with these gloves on, and yet we become
right.
complacent.
Yeah, it's a false sense of security.
Yeah.
Hands.
Yep. Jenny, thank you so much, Carol. Appreciate that. Jenny, is there anything there you'd like to add? Do you think any changes to ServSafe or Safe Staff?
No, Carol, you hit any bullet point that I even had and took it to a new level. I'm so refreshed in hearing all of this, because certainly all of it is positive, right? Like the only thing I could add is that in some of the chemical usage and the right things to use for certain things is something we're working on with our vendors to make sure we get that known to our customers and restaurants all over. But positive changes no matter what. So I'm not even going to try to follow that, but thanks.
Thank you, Jenny. Thank you so much. Joe?
Chris, did you want to add anything to the ServSafe before we move on?
No, all was covered great. It's, ServSafe's an ever evolving program, as it should be, because we are in an ever evolving environment and industry. And John's point is the one I stress all the time, which is the standardization is key. Otherwise, it can't be like the menu labeling rollout was nationally. That was such a mess. So whatever is determined to be the safest approach for restaurants and food service to approach this and be prepared for this, I think is the way we need to go. And I know Carol and her team will do a great job with that.
Great. Chris, if I could, we just had a comment or a question come in from people watching, and you could certainly field this question, and anybody else who wants to comment after. What do we think about table service? How is all this going to affect table service at a full service restaurant?
Yeah, I think the social distancing for the consumer is a piece. We had a conversation today about whether or not if you comply with the social distancing, do you take out the extra tables, or do you do a hopscotch type approach where you seat every other table? The issue with the hopscotch approach is the table's still sitting there, so it forces your server to be closer to the table than they would otherwise if you could take them out. So we're talking about putting pods in our parking lots for a period of time and taking those tables out there and laying out the dining room the way we would want to if that was our set capacity, rather than have empty tables everywhere with signs on them that say "Do not sit here" with a skull and crossbones and everything else. So that's how we see it going to be different. And obviously leaving some space for the server to not be right on top of the table. I don't think you're going to have the server kneeling down and getting so close to the consumer anymore. There needs to be, not to the extent of the video that John mentioned that I saw that is hilarious, but there will be some considerations there. And I think that's how I see that changing.
What's going to be really hard is changing human emotion, because I had a meeting with a gentleman the other day, and I just walked right up to him to shake his hand. I wasn't even thinking. And it's going to be hard to get our servers, like you say, not to kneel down next to him, sit in a booth next to him, and because that's our human nature to be hospitable. And it's going to be very, very difficult to train our staff that way to not do that. It's going to be tough.
Yeah.
As far as table service go, if I could add to we've thought a lot in working on gaining our inventory on, portion controlled items, no more shared ketchup and those things, the tabletop things that we're all used to. Maybe if they want ketchup, put it in an individual container for them, or a souffle cup, just little things like that we know a lot of people will want to see and adopt. But John, if you figure out how to change human emotion, let me know. I'd like a tip on that.
All of us.
Yeah, we all need a hug.
Right?
I think it would be fair to say that all of this is still fluid, and it's certainly a learning curve, and we just have to be patient and learn from the changes and move on.
That's right. Yeah. Well, this has been fantastic. I mean, we're already at almost 50 minutes here, and just 50 minutes. I mean, we've covered so much. It's such a valuable comments from all of you. We truly appreciate everything you've given us. I'm making my restaurant management class watch this, because this is being recorded too, and can't thank you enough. I just think everybody here on this panel has been so great, and it's obvious that you all care so much about not only your own restaurant, but the entire industry and the state of Florida and in the U.S. So our hearts and prayers go out to you guys too, to every business trying to stay afloat and work hard during this pandemic. I would like to, and it's interesting too, just a quick comment. Man, there's so many comments and questions coming in. I mean, there's no way we're going to get through all of these, and we're going to end it right here. But there's a lot coming in on employee HR type questions. So this is kind of budding a whole new webinar. And I'd like to keep in touch with the four of you and bring you back in a month or two, or if you're available, and just kind of see where we're at. It's been great hanging out with you guys and talking with you all today. Thank you so much.
Joe, I hope I'm busy in a restaurant in a month from now.
There we go. There we go.
You will. All of you will.
Good point.
I hope I don't have time.
Good point. That's a good sign. Well, I'm going to sign off right now. I know Gary and I both thank you. Thank you so much.
Thank you so much.
Thank you for having us.
You're all brilliant. Thank you.
Thank you.
Have a great weekend, everybody.
Take care.
Thanks, everybody.
Hey,
Bye-bye.
bye.